you know that in the last years, or in the last 4 or 5 years, we are seeing how important is to do a genetic testing in those patients who are candidates for that, in those patients who had breast cancer who are candidates for that. Of course, the ideal situation would be to get the genetic testing in those who are not patients, just to know their risk. But we are talking about breast cancer patients. So we have to understand that it's not only important to know if they are mutation carriers or not in terms of the surgical approach, but nowadays also in terms of the systemic treatments. So the landscape in the patients who has breast cancer and a mutation carrier has changed so much that I think that it's so important to understand the need to have that genetic testing. And no woman who are a candidate for that can go through their treatments without having that. So saying that, because the systemic treatments has improved the oncologic outcomes in those patients with breast cancer and mutation carriers, we can also de-escalate the surgical treatments on those patients. And I think we are now in a time that we need to see how these systemic treatments affect the contralateral breast cancer in those patients with a mutation carrier, because this is the most highest rate of having another breast cancer. More than in the index in breast cancer. So we will have more and more data of seeing if these patients can undergo, less contralateral prophylactic risk reduction mastectomies and less surgery with the new systemic treatments for the mutation carriers and breast cancer. So I think it's an exciting time for these patients, and hopefully we will have some data in the next years.